The levator scapula is another very important muscle for a number of reasons. Its pain pattern tends to go about halfway up the neck, down into the interscapular area, and then out over the top of the shoulder. It restricts cervical rotation to a very significant degree. Now, a real tip to make sure before you ever treat the levator scapula, if you check for cervical rotation, first treat the bicep and then treat the levator scapula. You should see a marked improvement in your results when you do that type of a thing. Now, because of that type of pain going down in between the shoulder blades, many people like to work really hard doing a lot of techniques in between the shoulder blades. We tend to do airplane type exercises to strengthen the area. Massage therapists tend to rub it. We do ultrasound in the area. People manipulate the area. The pain pattern in the interscapular area very oftentimes comes from the levator scapula, and you can tell that by the restriction of cervical rotation. Again, a very, very important point. So your postural clue for this muscle is going to be shoulders raised up, just like the upper traps, and a lack of cervical rotation. Given all of those, you're going to want to go out and do the treatment techniques on these. The diagnosis that you get with this is a stiff neck. Let's go treat the levator scapula. The referred pain pattern from the levator scapula comes from about halfway up the neck, out through the trapezius, and then down through the interscapular area. So what we want to do for its movement, we're going to test the range of motion in cervical rotation. It oftentimes limits that type of motion. Now, in order to do the treatment for this, first, I always do the bicep. Oftentimes releasing the bicep will cause a relaxation and allow the neck to move more into lateral flexion. So prior to this, always do the bicep. Now let's go ahead and treat by holding onto the side of the table. That helps to anchor the shoulder. We're going to turn the head about 45 degrees and tip the chin. And what I'm going to do now is I'm going to take up the slack of the muscle this way, spraying over the shoulder one time, twice into the interscapular area. So deep breath in through the nose, sir, and exhale. Out over the shoulder. And again, deep breath in and exhale. And we're coming down into the interscapular area right along the side of the border. And deep breath in again and exhale. And this time I'm going to come right along that last spray angle. And I'm going to bring him up out of that position, very important so he doesn't tighten back up. And let's retest the motion. Again, we have significantly better rotation at this point. And then I'd like to apply the heating pad to warm the area back up. And again, I want to go between the interscapular area, over the shoulder, and up the back of the neck. Okay, when we're done warming the tissues, we need to go into the stretch position, which is the same position we used in order to spray. So we're going to anchor the muscle to the chair, turn the head forward about 45 degrees and do a chin tuck, and bring the hand up. And just pull in that nice direction there. Now deep breath in through the nose and out through the mouth, about 3 times. Inhale and exhale. And again, putting that good stretch on there is going to relieve the pain coming into the shoulder blade and out through the side. And it's specifically something that can be done in a chair at work. I like to make sure whatever stretches we give to the patients, they can take home with them. And one more, there we go. And when you're done, bring that hand to push the head back up. There we go.